Vascular distensibility. A valuable characteristic of the vascular system is that all blood vessels are distensible. We have seen one example of this in the previous lecture. When the pressure in blood vessels is increased, this dilates the blood vessels and therefore decreases their resistance. The result is increased blood flow not only because of increased pressure but also because of decreased resistance, usually giving at least twice as much flow increase for each increase in pressure as one might expect. Vascular distensibility also plays other important roles in circulatory function. For example, the distensible nature of the arteries allows them to accommodate the pulsatile output of the heart and to average out the pressure pulsations. This provides smooth, continuous flow of blood through the very small blood vessels of the tissues. The most distensible by far of all the vessels are the veins. Even slight increases in venous pressure cause the veins to store 0.5 to 1.0 liter of extra blood. Therefore, the veins provide a reservoir function for storing large quantities of extra blood that can be called into use whenever required elsewhere in the circulation. Units of vascular distensibility. Vascular distensibility normally is expressed as the fractional increase in volume for each millimeter of mercury rise in pressure, in accordance with the following formula. The vascular distensibility is equal to the increase in volume divided by the product of the increase in pressure and the original volume. That is, if 1 mm of mercury causes a vessel that originally contained 10 mm of blood to increase its volume by 1 milliliter, the distensibility would be 0.1 per millimeters of mercury, or 10% per millimeters of mercury. Difference in distensibility of the arteries and the veins. Anatomically, the walls of the arteries are far stronger than those of the veins. Consequently, the arteries, on average, are about 8 times less distensible than the veins. That is, a given increase in pressure causes about 8 times as much increase in blood in a vein as in an artery of comparable size. In the pulmonary circulation, the pulmonary vein distensibilities are similar to those of the systemic circulation. But, the pulmonary arteries normally operate under pressures about 1/6 of those in the systemic arterial system, and their distensibilities are correspondingly greater, about 6 times the distensibility of systemic arteries. Vascular compliance, or vascular capacitance. In hemodynamic studies, it usually is much more important to know the total quantity of blood that can be stored in a given portion of the circulation for each millimeter of mercury pressure rise than to know the distensibilities of the individual vessels. This value is called the compliance or capacitance of the respective vascular bed, that is, vascular compliance equals increase in volume per increase in pressure. Compliance and distensibility are quite different. A highly distensible vessel that has a slight volume may have far less compliance than a much less distensible vessel that has a large volume because compliance is equal to distensibility times volume. The compliance of a systemic vein is about 24 times that of its corresponding artery because it is about 8 times as distensible and it has a volume about 3 times as great. 8 times 3 equals 24. Volume pressure curves of the artery.